The Be Fit for Health radio show was previously recorded. The views and opinions expressed on the following program are not necessarily those of the staff and management of Salem Media of Hawaii.
Aloha and welcome to Be Fit for Health. This is Bianca, your host. It's another great day to celebrate our health and wellness in this beautiful island that we live on. And I just want to say, I'm always grateful to wake up to this beautiful weather that we have, and to the people that live here on this island. I am very blessed and feel very lucky and fortunate. I will always start the show off with a positive note because I think we need that more than ever now, with everything that's been going on for the past year. Everybody seems to be starting to come back to normal slowly but surely, and hopefully this time next year we'll be back to where we were before as far as our normal existence on this island. I just want to say, this health show has been very versatile. We've been going through different types of ailments and different types of medical practitioners, and we have not yet had a dentist on. And, and this dentist that I'm bringing on today is not just any dentist. He actually has some pretty good understanding on different aspects of your dental health, but also your overall body health, which you never really expect that from a dentist. But we're going to find out today about how your dental health can affect your entire body system in the way that your body may develop disease or the level of intensity of the disease that you may have. And we're going to get into some really interesting topics, and hopefully the time that we have is going to be enough, but you know how that goes. Once we get into it, it always ends, and I'm really upset because I can't get more information than I'd like. So just to let you guys know, Dr. Terrance Young was born and raised here in Hawaii, but he received his respiratory therapy degree in Omaha, Nebraska with, I can't pronounce the name, but he'll give it to us. I don't know why. For some reason, today is not my day for reading and speaking. But he graduated from the University of Pacific School of Dentistry after he's got his respiratory therapy degree. So that wasn't enough. He went back and got some more degrees, which he's brilliant. I'm telling you guys, I can't wait to get into this. He's been into this field for 30 years and still maintains a license in California as well. So, wow. I didn't know that, Dr. Young, but I'm learning something new every day. He's became interested in sleep disorder breathing in 2014, which is a topic in which we're going to be discussing about, because you guys have no idea the information he's going to share with us when it comes to sleep disorder and breathing and your dental health. His understanding of respiratory psychology and dental craniofacial development allowed him to treat patients with SDV with varied modalities such as the CPAP, told you I can't talk, the CPAP machine, as well as focusing on orthodontic appliances and mandibular advanced device. Dr. Young practices Airway focused dental care. He sees referrals for adults and children, which I think is so imperative because I don't think people understand that dental care for kids is more important, I think, because of the development, right? And his sources are such as neurology, sleep medicine, pulmonary, internal medicine, and psychiatric speak language myofunctional therapists. These are all referred to him by these type of specialists to get the dental care that their patients need. As well as for him, this has been a rewarding journey collaborating with healthcare providers for a variety of disciplines. I think he feels this is something that is lacking, and I think he's the only doctor on the island that's a dentist that deals with such in-depth care of not just your mouth, but your body system. So Dr. Young, thank you so much for coming on to the show. I know you're very busy, and I appreciate you taking some time to educate my audience, because this audience has become very well-versed on certain diseases and modalities and options, but this is something completely new. So I'm really excited to dive right in.
Hi, Bianca. Thanks for having me. Appreciate it.
Well, yeah. Tell us a little bit about yourself, Dr. Young, because I know I kind of botched your bio. If you can give us a good idea of how you've come to this point and what you're doing currently with your practice.
Sure. Well, my undergraduate degree was in respiratory therapy a number of years ago, and It was a great, it was a field that was very interesting to me, respiratory physiology, and just kind of helping people in those kind of situations. And then on to dental school, and practiced dentistry for many, many years. And about, I think, 6-7 years ago, attended a seminar about how the upper and lower jaws develop, and how that development affects our airways, and how the airways and oxygenation affects many parts of our body. You know, oxygen is the most important
Right.
element for us all.
Right.
And yeah, so that's how it started, and it hasn't stopped, and it's just taking many courses and seeing many patients, and just learning every day about all these connections, and they're so important to our health, because and it starts back from actually pregnancy, and can lead to sleep disordered breathing, which includes obstructive sleep apnea and other things such as UARS, upper airway resistance syndrome, which affects so many people. But it's also one of the most underdiagnosed issues today.
Well, not too many dentists understand this anyway. So when you go to a dentist as a child, which when I was a kid, I had a lot of cavities without having it was genetics. It wasn't even anything that I was eating. Maybe it had to do with the shape of my mouth or the amount of teeth that I had, but it also had maybe the size of my tongue and the breathing aspect when I was sleeping. But nobody understood that back then. So this is kind of an interesting concept.
Right. It actually goes back quite along with it. You know, there's the knowledge of a lot of these issues goes back a very long time. You know, over 100 years.
Wow.
It's just that all these bits and pieces have been a lot of information has been lost, and oftentimes reemerging. A lot of these issues did not occur in these Aboriginal type communities, civilizations. It seems to be more of since the industrialized revolution, when diets changed, including also breastfeeding and bottle feeding, and that's where a lot of the issues start to emerge from.
Like sucking your thumb as well as a kid, maybe that doesn't help either?
Well, a lot of people now, we look at that sometimes as sucking the thumb and other habits, holding the fingers in the mouth, are compensations for issues going on in the development of the upper and lower jaws. So,
wow, yeah, I would think that would make an impact. I know for me personally that I had I would wake up tired even as a kid, and that didn't make any sense. Maybe it was the fact that sleeping, I wasn't getting enough oxygen into the brain. So tell me exactly what the sleep disorder breathing is. Like, what does that mean exactly?
Well, maybe I'll do a quick rundown from the beginning, from pregnancy, and then kind of quickly move through the development of this issue. Okay. It starts off, a lot of issues occur during pregnancy that many people aren't aware of, that can affect children, but and even the birthing situation creates issues too. But one of the most important things right after birth is nature intended us to breastfeed our children, right? And so one of the first signs was there any challenges in breastfeeding immediately after birth? And you find that quite a few moms may have had trouble with the breastfeeding process for a number of reasons, and one of the reasons, oftentimes children's tongues are tethered. There's different names for this: tongue tie, tongue tether, ankylglossia, different terms. But what happens is that the tongue cannot easily reach and breastfeed as nature intended, and so very oftentimes bottle feeding is introduced more quickly than it used to be. Right. thinking that it's a convenient way to feed an infant, and then even formula is introduced. But it's all about where the muscle memory of the tongue is, because when you breastfeed, and for in some cultures they breastfeed 2-3+ years,
Right.
while introducing foods that are either chewed up slightly by the parent to soften for the child,
Right.
and or minced up, and hard, chewy, fibrous foods are good because it creates bone growth. Bone growth meaning the upper jaw, the lower jaw growing wide, and the upper jaws moving forward. That growth process begins at infancy and starts to slow down around 12 to 14 years of age. So you got this period where the upper and lower jaws are developing, and how the upper and lower jaws develop can contribute to the airway. It can actually hinder the airway if the upper and lower jaws are not developing properly, and so that's how dentistry is involved with sleep disorder breathing, which includes obstructive sleep apnea and other types of airway challenges.
Well, that's really interesting. I didn't know that.
Yeah. So what they have found is that for instance, many of the jaws, many children these days, their jaws are developing very, very narrow, and so when the jaws are narrow, there is not enough room for the tongue. So the tongue space, where the normal resting place for a tongue is not ideal, and so it's like the tongues have remained about the same size over the course of the last several hundred years. But what they have found is recent studies have shown that the upper and lower jaws are not growing as wide or moving as far forward. And a lot of that has been they've been finding due to diet and tongue position and the way we've been feeding our children.
Got it.
Yeah.
Now, can that be genetics too, though? I mean, that's just, besides the fact of chewing and developing and stuff, genetics can play a role in the size of the mouth and the number of teeth that you have, and the way that you're positioning of your tongue, right? That has...
Yes, no, definitely. Genetics, we are more than likely predetermined to grow wider and move more forward. But the habits and what happens with the muscles are much stronger than the epigenetic potential, the genetic potential, and so these factors are factors which are holding back the growth. I mean, the muscles are stronger than the genetic potential that's encoded.
Huh.
So, in fact, if you look at jaws of people, even maybe 100 to 200 years ago, a lot of them are much wider, and the third molars, the wisdom teeth, there's room in the mouth for the third molars.
Oh, wow.
We are designed to use those third molars, the wisdom teeth, to eat and chew, and as part of our natural dentition, the teeth that we have. But nowadays, all the jaws are shrinking, and that's why, in most cases, the third molars, wisdom teeth, have got to be removed because there's no room in the mouth for them.
Yeah,
exactly. And so this has caused an ongoing issue. And then, along with the smaller jaws and smaller but narrower,
right?
And then you have these high palatal vaults, high palate. Well, and then so many people who have high palates also have trouble breathing through their nose. And if you look at a skeleton, you see that the top of the palate, the top of your mouth, the roof of your mouth, is also the base of your nose. And so if you look into a well-developed nasal cavity, that in a skeletal model, you see that's already a small space. And
right.
Imagine if the if the palate is very high, it makes a small space even smaller, and it does affect nasal breathing. And so the interesting part of all this is that we actually get better oxygenation when we breathe through our nose rather than breathing through our mouth.
Right. Studies have shown that.
People do not understand this.
No, yes. Recent studies have shown that breathing exercises, they prefer you breathe in and out through your nose just because of the capacity.
Yeah, and there's the respiratory physiology behind that. There's this chemistry behind why that is. And when we breathe through our mouths, we're exchanging a lot more air through our passageway going down to our lungs. When we breathe through our nose, it's a much narrower space, and it's a more controlled in and out volume of air, a much smaller amount of air. And there's a key factor in here, which we learned back in respiratory therapy. My education is that has to do with CO2. Many people disregard CO2. They don't think much about CO2 or its importance. The air that we breathe is 79% nitrogen, 21% oxygen, and 0.05% CO2.
Right.
And yet it's so important. So when you breathe through your mouth, they've found that you breathe through your mouth, oftentimes, whether it's a deep breath or more rapid breathing, you can actually decrease the CO2 level that's going into your blood. And what quickly happens there is you get a shift, and there's a name for this. It's the Bohr equation, B-O-H-R. These are things that many healthcare people study. We all study it, but then sometimes after the test, we kind of lose its significance in the aspect of helping patients. But what happens is, as soon as the CO2 drops, you get a change in the acidity of the blood, and what the oxygen is traveling around the system, but it cannot easily release into the tissue and into the brain, and that's what happens. It does affect our oxygenation. When there is a difference between nasal breathing and mouth breathing, but we are designed to be nasal breathers, and better oxygen is just one of the positive things. The other things is the nose is designed to humidify and warm the air that we breathe.
Right.
Also filter. And here's a really interesting thing, Bianca. It's like we've all with this COVID issues going on and all the wearing of masks and things like that. There's some important factors here that come into play. There's our nose is a very important filter. In fact, and you might have, I'm sure you probably discussed vitamin D3 and the importance of D3 and things like that. But one more aspect of that is that there's a protein that's made in the body, and a number of years ago they thought it was just made in the kidneys, and kidneys or liver. I'm sorry, I got to get that little bit straight. But it was thought to be made only in the body, but then they found recently that it's also made in the nose, and that it's called cathelicidin. It's a peptide that is antiviral, antifungal, and antibacterial. And here it is being made. It's also known to be made in the nose now. So that's an important part of our protection. So when you wear a mask, everyone should be also trying to breathe through their nose, because if you wear a mask and breathe through your mouth, you're also losing the biggest filter system.
Right.
Antiviral system is your nose and the natural cathelicidin that's being produced there. So that's I find that very interesting.
That's very interesting. I did not know that either. This is great. I mean, who would have thought? I know that we, through the cilia in the nose hair that we have, I know that there's that filtration system where it catches debris and some other stuff. I had no idea that we had an viral bacterial type of protection protein based, that was designed to be assigned to the nose area from the liver itself. That's pretty cool.
Right.
It's pretty cool. So that's So that's kind of, I'm sure you're not done with your explanation, but that's kind of one of the reasons why I was asking why sleep disorders, breathing is even imperative, and what does that mean? Because I know that sleeping is one thing, but how about disorder while you're awake? You know, people have a disorder in breathing when they're even awake. We hold our breath, or we don't even breathe properly.
Right. Yeah. So there's some really interesting things about that too, that affects many, many, many people, and that is how we breathe, the rate that we breathe, the depth of our breathing. You know, whether we're breathing from the diaphragm or more shallow through just the chest. You know, if you put your hand on your chest and you put your hand on your stomach and check your normal breathing, you know, you can see where you're kind of breathing. But throughout the day and throughout different circumstances, we can very easily change our breathing and take in deeper breaths or more breaths. And that directly affects a lot of our physiology, and that's a lot of this is also related to anxiety.
Yes.
You know, that whole thing about CO2 I mentioned is that oftentimes when someone gets irritated or excited or scared, the breathing changes, and you can quickly, you know, we talk about panic attacks. Well, there's a lot of good research showing that panic attacks oftentimes occur. This physiology changes. Someone, you know, like, let me give you, for example, you hear a lot of parents talk about their kids, like, oh yeah, my child does so well in school, you know, they get good grades, but as soon as they go to a big test, boy, it's like they forget everything. Well,
right.
There's a lot of truth to that statement because, right, you know, well, here's what happens. A lot of times in a test, there's a lot of, you know, a lot of pressure on the student, and sometimes you watch kids how they take tests, and I even, you know, think back to me taking tests. Sometimes you can sit there looking at a question and you're trying to figure it out and trying to remember things, and you take like a big sigh, like, you know,
right.
You see a lot of people sighing. Well, a big sigh is also a big mouth breathing episode, and slowly you're dropping your CO2 level. And then also to make you a little stressed, maybe the respiratory rate goes up a little bit, or more quicker, shallower breathing. And you can watch on there's devices called capnometers, and you can watch how people respond, and you can watch what the expiratory CO2 level is, and then you can see how their physiology changes. And so what happens is, yes, indeed, as the breathing changes and the CO2 levels drop in certain circumstances, you can then, you know, you look back at that Bohr equation I talked about. So less oxygen is being delivered to the tissue and to the brain. And so, yes, your child is forgetting what they're thinking. So we can actually put, you know, people into this state pretty quickly and easily, and ask and have them, hey, when they're lowered CO2 level, give them a magazine. Hey, read this first paragraph. Then after you kind of help them get their breathing back to normal, you ask them, what did you read? And many people say, you know, I don't know. But so, and as that oxygen level drops further, that's, you know, it triggers what, you know, many people refer to as panic attacks, because yes, there's not enough oxygen going to the brain, and that's when panic attacks signal, and then, you know the old wives' tale about someone's having a panic attack, give them a brown paper bag to breathe in. Well, there's a lot of truth to that, because CO2. You're actually rebreathing CO2 and quickly helping the CO2 level rise, and that's why that works. You know, make people think about they think about these things, but you know the physiology behind it, it makes sense, and also then people who have anxiety, once they feel it, you know, many of the people who've got anxiety, you ask them questions and they feel it coming on. They know it's coming on. They just don't know how to control it, and then it becomes a downhill spiral.
Interesting.
But, you know, with that knowledge, people can learn how to, you know, close their mouths, breathe through their nose. If they're talking, stop talking. Talking is mouth breathing. You know, breathe through the nose easily, and you can bring back your CO2 level. there's
That's
all
such a
sorts
great
of,
trick.
Yeah.
And it's not a trick,
there's
it's a great
symptoms
tool.
that people feel.
Yeah.
Right. There's symptoms that people feel. They don't realize what they're feeling is decreasing CO2, but tingling in the fingers, a little stiffness in the neck, they can feel these symptoms coming on. So you can train people on that. That's another whole nother conversation. That's capnometry and respiratory physiology.
Well, that's why breathing exercises are becoming so popular. I think people are realizing more and more in psychology and all of these, empowerment speakers. They're all talking about meditation. And then through meditation, you're doing breathing exercises through the nose. They're trying to get people to slow down their anxiety or their, panics, when it comes to their life,
Right.
the stresses.
That's very true. The one thing that I worry about is that, one breathing method for one person could be great, but for another person could be bad. Because a lot of times, also these deep cleansing breaths, you've got to be careful. Right. They may be fine for some people in one situation, but if someone's already CO2 is dropping, a couple deep cleansing breaths can further deplete their, lower their CO2 level, and this, have them bring them right down to another panic attack. So there's a lot more to it that there's a lot more science to it. But definitely breathing and is necessary.
Right. No, absolutely. And you know what I'd like just to give you a 15-second break. I'm going to do a really quick commercial, Dr. Young. But when I come back, I want you to, since we talked about the waking state, I want you to talk about the sleep disorder, what that means to our body and health, and what that potentially could do damage-wise if we're not getting the right amount of oxygen into the body system while we're sleeping. So hold on tight, and we'll be back in 15 seconds.
You don't need to be a member of a gym to get your health and fitness back on track. Be Fit for You with a Be Fit for Health online personal training and nutrition program. With 30 years of personal training experience, Bianca will help you better yourself and be fit for health. For more information or to schedule a free wellness consultation, visit BeFit4Health.com for more.
Awesome. We're back. This is Be Fit for Health radio show. We're with Dr. Terrance Young of Dentistry, and we're talking about respiratory and dental care. And how do those two work together? Well, you'd be surprised. We've been talking basically about breathing and CO2 and how that's an important factor with nose breathing versus mouth breathing. And this is in our awakened state. So, Dr. Young, besides the other aspects of panic attacks and things like that, I've had a panic attack when I was sleeping. So it woke me up. This was many years ago. And I couldn't understand. It's not like I was stressed out when I was sleeping, but what could have caused me having a panic attack while I was sleeping? Could it be the fact that maybe I was holding my breath? Or
no, well, probably more than likely something was going on that was decreasing your CO2 level, and that could be your mouth breathing.
Mouth breathing, yep.
And So your question about how it affects the body. Well, let me just quickly go back a second. So how our upper and lower jaws develop wide and moving forward affects the airway from the tip of your nose down to your lungs. And, just to kind of put things in perspective, for instance, 2012 report from the American Heart Association out of Baylor, a study was done. And the conclusion was that obstructive sleep apnea is the cause of cardiovascular disease, increases the risk of stroke, and is also associated with dementia in the elderly.
Makes sense. And
now we even know that dementia is also associated with Alzheimer's. So many important factors occur as we sleep that affect those issues. So your question was about
sleep disorder, breathing.
How does it affect your body?
Yeah.
Right. So your airway, as you sleep, is affected by how your upper and lower jaws have developed. Because if you have narrow airways, oftentimes you have small. There's not enough room in your mouth for your tongue. Oftentimes,
right.
And so when you sleep, especially on your back, it kind of clogs up the airway,
right.
and you get snoring sounds. and things like that. And that's the main parts. But there's also other things that occur as we sleep. Most of the time, people are talking about obstructive sleep apnea, which are large drops in oxygen as we sleep. And, it's measured by what's called AHI, apnea-hypopnea index. And these are drops in oxygen greater than 4% of normal being roughly around 98%. So big drops in oxygen, and what it does is, so it's how many episodes per hour. So how many times an hour does your oxygen drop greater than 4%? And so the criteria in a sleep study would be under 5 is considered normal episodes per hour. So 5 to 15 is considered mild, 15 to 30 is moderate, and over 30 is severe. But and unfortunately, that terminology of mild, moderate, and severe, many people are in mild and think, well, it's just mild, so it's not that bad, but it is a significant health risk factor and should be addressed. So, if you have mild, please get it addressed. Even less than 5, it could potentially be.
Eventually, yeah.
Yeah. And then on the other end, there's what's called upper airway resistance syndrome. So these are measured in, they refer to it as RERAs, RERA, it's respiratory effort related arousals. And these are smaller drops in oxygen as you sleep. And these are between 2 to 4% of normal. So these are small little drops in oxygenation. And oftentimes they're thought to be not that important. But, the part that I think you and I discussed this before is whether you have a small drop in oxygen or a large drop in oxygen, there's still, it affects the sympathetic nervous system, and there's still a sympathetic nervous response. And that response is a release of epinephrine or adrenaline into your system. So these small or large drops are releasing, having a sympathetic response. The sympathetic response also, that's the fight or flight response. If you get really mad at somebody or really scared at something, you felt your body trembling, and that is the adrenaline that was released into your body as a protective mechanism to get you ready to either to fight or run like heck. The fight or flight. It's the same thing, and that happens when you're sleeping. It may not awaken you. Oftentimes, it'll cause a lot of tossing and turning while you sleep, and so some people sleep very restlessly, and when and people wonder why. Well, this could be one of the likely reasons. But these sympathetic responses going on through the night causes fragmentation of your sleep cycles. We have 3 main sleep cycles, and many important things happen during these sleep cycles. Right. And when you if you don't successfully get into your first sleep cycle, it's hard to get into your second and your third. But some of the things that occur, like in the second and third, is certain hormones are released. Growth hormone is released. Growth hormone, especially in kids who have sleep issues. A lot of times their development is a little slower, and they're not growing at the rate that they likely could be growing, and it's because if you disrupt their sleep cycle and growth hormone may not be released as easily, so you've got challenges like that. But also other things are, which people don't really think about too much, unfortunately, is that antidiuretic hormone is also released. It tells your body, tells your brain that, hey, you don't have to wake up throughout the night to use the restroom. But if you're having disruptions, you find people waking up 2, 3, 4, 5 times a night thinking they've got to go use the restroom. But our bladder usually has sufficient capacity to maybe just go once, but to wake up 2, 3, 4, 5 times and realize you're not going that much. Well, that's not normal because antidiuretic hormone may not be released, and as a result of fragmented sleep, as a result of sleep apnea. So and also a really interesting one is they've got even a video now. Brain cells, Alzheimer's, dementia, has plaques on the brain. They determine these plaques on the brain, beta amyloids that collect, and your body in normal sleep cycles actually washes away these plaques. Like plaque in your teeth, plaque in your brain. But there's a process that washes it away. But if you're not successfully going through your sleep cycles, this does not occur. And so that's why, the researcher Ron Harper out of UCLA, he showed us brain scans of someone who had severe obstructive sleep apnea and someone who had severe Alzheimer's. And when you look at the parts of the brain that are all dimmed in these types of radiographs, you see that they could be interchanged. The same areas that are dark and not lit up anymore, it's like interchangeable. And so, there's close connections between these things as they've discovered. So many important things as we disrupt our sleep cycles. There's a lot more that happens. Hormones are released, short-term memories are compiled.
Right.
So
rehabbing your system and your organs, everything. Yeah. It's all imperative.
Yep.
That's why they say to go to bed by 10 and get up by 6, because there's a certain cycle, right, that goes through your body.
Circadian rhythms too. Yeah.
Yeah.
Circadian rhythms are so important. I mean, there's so many connections with so many things. When we were living in caves, lights out when the sun went down, and that reset all of our circadian rhythms. Sun comes up in the morning, you walk outside your cave, and boom, you get hit with the sunlight, which starts activating all the important circadian rhythms.
Serotonin and everything.
That are important. Right. Yep. Yeah. And so all of that is so interconnected. It's crazy. I think that our healthcare fields are very fragmented. We're all looking in only in one direction many times, and not looking to the left or right. And a lot of it we've been trained to be careful. Don't look too much far to the left or right, because otherwise you can get sued because you're not staying within your lane,
practice or your license. Yeah, it's crazy. I think you're right though. What you're onto is so huge that the simplest things that we need, right? Sleep, breathing, right? The right types of food. Yeah. I mean, those are the 3 things that we need in order for our body to sustain somewhat of a balance and movement. I mean, if you can move just the right amount, your body then gets, strong, just enough. But you're trying to fix which is basically fundamental.
Right. I mean, our immune system. People get sick, and oftentimes you keep tracking back, and you look back to see if they're getting proper oxygenation and sleep. There's a lot of really good studies that have shown that, our immune system can be boosted so much by just good oxygenation and sleep. I mean, significantly. Our body compensates, but sometimes long-term those compensations are detrimental to us.
Yeah, I agree. And like I said, there's a lot of case studies now where it shows this breathing actually starts to help repair the body the way it should. Now, I don't know how that would help with your dentistry, because I know that certain level of deterioration is already there. It's already too late. You have to then fix it. But preventative wise, you would suggest, future injuries.
So how dentistry and when we do this airway dentistry, it's the conventional cavities and things like that. That's important, definitely to our health. But what we're concentrating on now is the development of the upper and lower arches, and then also the correct. It's called myofunctional therapy. Extremely important. This is how. These are the muscles that we swallow, the muscles that we speak, the muscles that, how we breathe, our tongue position. All of these are so important because they've also found, research out of Stanford and other countries, other places, found that when you have good myofunctional competencies in place, you can decrease the severity of your airway issues by up to 50%. So it's extremely important, the competencies, proper adult swallow, nasal breathing, lips together, proper tongue resting position. These are all important because the tongue is a very strong muscle. It is what causes our upper and lower jaws to develop from infancy to about 14 years of age. If your tongue is not in the right spot, your jaws are not developing as they should. And so then you've got orthodontics.
I was going to say, yeah, I had to do that.
To help that along.
Yeah.
Right. But there's a difference now. There's some changes going on in the industry, and slowly changes. So orthodontics has for a long time been, moving your teeth into a good functioning and aesthetic positions. But we're finding there's more to that. It has, for some people who start having symptoms of sleep disordered breathing. You need, as they're developing, they may need to expand the jaws wider and making sure it can move forward. So you're going to be seeing a lot of changes already in place and going on in this field. But so that's how a dentist can help you breathe better and to get rid of the sleep disorder breathing, because you don't want, especially with kids, you can stop it in so that the sleep disorder breathing does not move on into adulthood.
Well, you need the right dentist too, though, because not every dentist knows what you know, though. I mean, they do, but they don't know what you know to that level.
Well, the American Dental Association back in I think the fall of 2017, I'm pretty sure, or 2018, they finally put something in that recommended, as a strong recommendation, that the dentists start being able to look for signs of sleep disorder breathing and look into possibilities of treating this early. But it takes a while for these things to happen. And I think it was only last year that a dental school started teaching about dental sleep apnea and what we can do for this. So it's just in its beginning phase as far as getting the concepts moving forward. So, but at least they are moving forward, and that's what's important. And more dentists are getting involved in it. There are a few other dentists here. I'm not the only one here in Honolulu, so I just want to let you know that.
Okay.
But it's become a very much passion for myself and our practice, and we're really happy to be involved in it. It's for me, it's exciting, and it's we've done the cavities and crowns and things for many years, and this is a really nice way to I think contribute to more better health for our patients. And,
oh yeah. Well, you're the only one that I knew of that did this, and that's why I wanted you on the show. Mm-hmm. But besides that, though, how do I know, or if my child has this, the sleeping disorder, how can you test us out? What do you do, and what do you put us through to figure out whether or not we are a good candidate for assistance?
Right. Well, some of the things are, like ADHD and things like that are directly associated with this now too, and so a lot of psychiatrists, psychologists are realizing this, that if you don't get better airway for the kids, that medications are not going to cure the issue.
Right.
But so you watch your child, how do they sleep? If they sleep with their mouth open, that's the first big one. If they sleep with their mouth open, then there's an issue.
Right.
An issue, because developmentally, a child mouth breathing will the upper and lower jaws and the teeth coming out will not develop as nature intended, and that's why we have so many orthodontists, because mouth breathing is one of the greatest contributors to that. So mouth breathing, look for mouth breathing. If the child is not getting enough oxygen at night, oftentimes they wake up, grumpy, or they're very tired, hard to get up, and that's the ADHD type behavior. You've got stuffy noses, hard, chronic trouble breathing through the nose.
I had all that when I was a kid.
Yeah. And then also looking for, there's no refreshed sleep. And then also a lot of times there's lots of movement while they sleep. Legs are thrashing, moving around. And there could be snoring sounds, quiet snoring sounds. And then sometimes even no snoring sounds, just loud breathing and sleep positions, sleeping with the mouth open and the head back, sort of like in the rescue position for CPR. The neck is extended backward, trying to grasp for air. What else? Waking up bedwetting is associated with this. There's so many things are associated with this. Night terrors, waking up all hot and sweaty.
Oh, wow.
There's a long list.
Well, if you can send that to me, I can post that on my YouTube when I re-put this video up. But if people want to be able to access that, or they can reach out to you too at the end of the show, we'll give them a way for them to call you or reach out to you.
I could send you a list of things that we ask, and then some of the common things that we ask in our screening for this. Yeah,
because people are going to want to know, because this is really anyone who has irregular heartbeats, anyone who gets headaches a lot, body, you said, shoulder, neck pain, all that stuff, even maybe digestive too, because that your diaphragm gets affected. Everything gets connected, and then also your nervous system, right? Because your vagal nervous system is connected to the breathing.
Right. So let's see. You mentioned something right there. I want to tell you and jump on that. I know. So cardiovascular-wise, a lot of people have high blood pressure.
Right.
And high blood pressure is directly related to sleep apnea in many cases. Not all cases, but in many cases.
Right.
And so how it's conventionally treated is medications, go on a diet, and on and on. But oftentimes people go on diets. You can have someone rail thin and still have high blood pressure. They go on different medications. They go on different dosages and change meds, things like that. Then oftentimes it develops into arrhythmias.
Wow.
If you look carefully at these sleep studies, and you look at how the oxygen drops, and you look at the heart's response throughout the night, you realize that sometimes the heart's jumping up 20, 40 plus points throughout the night, and your heart should be resting at its baseline heart rate, and it's not. It's just that people don't see this information, and oftentimes a lot of that visual part, you've got to dig into the sleep study to really find it.
Yeah.
So, it's all important, and undiagnosed sleep disordered breathing is one of the most highest amount of undiagnosed disease processes, and it's statistically, you lose a portion of your lifespan, decreased lifespan
without realizing
if that's not treated.
Yep. It's crazy how something
all the
simple
driving
as testing.
hazards, driving and the sleepiness caused for driving. You look at some of these major train accidents in the past several years. They were related to sleep apnea, and the conductors and things were sleepy, and they weren't being they were obstructive sleep apnea wasn't trained. But if you look it up, a lot of these major accidents could have been prevented had there been better systems in place.
I can't wait when technology gets better at this. I mean, I know that you guys, there's sleep testing that you guys do where you have a gadget on and they test your breathing, and you do this for a couple of days to see what your breathing pattern looks like, to see whether or not you are holding your breath, or, because, with sleep apnea, people actually don't breathe for a period of time. And that pressure of not breathing, I mean, you could kill yourself without even realizing if you hold your breath for too long, especially during your sleep. That's why I think those are very severe cases. But why would you want to wait till you get to that point?
Right, exactly. Many people don't realize or admit that they snore or have or possibility of sleep apnea.
Yeah, if you don't sleep with someone, no one's going to know.
The most common response, how men and women respond to the question.
Yeah.
So if you ask men, they say, I'll ask them, so do you snore? And they'll say, this is how a lot of them will answer, well, my wife says I do. And so I just look them straight in the eye. Well, then you snore. If your wife says you snore, you snore. That's the answer. You snore.
You snore.
Women, oftentimes, I say, do you know if you snore? And they say, yeah, we snore. I snore a little bit. I know I snore. But that's the difference between men's and women's answers. It's kind of funny, but not that funny.
I think everyone snores to a certain degree, to be honest with you. I think it's just a matter of what level that it affects your health, and that's where you come into play. So, we're at the end of the show, and I told you this is going to go by really quick, and it's like getting really crazy for me whenever this happens. But what I'd like to do is first, get your information for the audience to be able to reach out to you, whether it's for dental work, whether it's for getting tested for this, and getting some information from you. I know you have a website. Your website is Airway Focus? You give me the
airwayfocuseddentalcare.com. airwayfocuseddentalcare.com.
And you're located in Kaimaki now, yeah?
Yes, we moved recently. We're located at 3660 Waialae Avenue, where that restaurant 3660 on the rise is.
Oh, okay.
So right in that building.
Okay,
Yeah.
and then what's a good number for them to reach you or your office?
Yeah, our office number is, area code 808-945-9977.
Okay. Now, any final thoughts that you'd like to leave with the audience regarding all of this, so that they have something to think about or look up, because they can look it up themselves?
If you Google sleep apnea or upper airway resistance syndrome, and by the way, you don't have to snore in order to have
right.
Airway issues, so that's
right.
important to know also. Good resources. Off the top of my head, there's all these organizations. I belong to a number of organizations, and they all have these acronyms, and I get confused with acronyms. But if people contact us, we'd be happy to, give them a list, or I can give you a list of good resources, because it's important to. Yeah, there are good resources and there are better resources. So I'd like to lead you to the better resources.
Sure, of course. And you and I will work together on that. So whether they contact you or they revisit this video again on my YouTube channel, and it'll be interesting. And they can go on your website as well, because I'm sure you have a wealth of information on there as well. So that's going to work out. So I do eventually would like to bring you back on, because there's so much information that we can go through. You have a lot of good stats and, publications and a lot of things that you've been talking about that I'm sure it's been an interesting conversation for people to listen to. But I have a feeling some of these things may have gone over their head. So, this is always this is an education show. So I'd like to have you back on to educate people again. And, maybe there are medical professionals that are listening to this that may have not even dawned on them that, dental care and respiratory may be going hand in hand. So, this may be able to help them maybe advise their patients, to seek out someone like you to get, more information. So,
yes, thank you. Yeah, the list of, medical people that we collaborate is growing, and which is great. And,
right.
We all healthcare providers need to collaborate much more.
Yeah, I
we
think
all have
so.
a piece to contribute. Yes,
absolutely. And it's better to have a bigger team for each patient than just one or two doctors, because I think more minds are better than one.
Exactly.
Yeah.
Sure.
Well, thank you so much, Dr. Terrance Young. You are awesome, and I appreciate your time, and I look forward to speaking with you again soon, and hopefully we'll be able to help more people from this show.
Definitely. Thank you, Bianca, very much for having me.
No worries. You have a great rest of your day.
You too.
Okay. Well, thanks. Mahalo.
Yep.
So everybody, thank you so much for spending the time with us again. This show was great, but of course, like every time, it ends so quickly for me. Maybe not for you, but for me, because I get so interested in this stuff. But yeah, reach out to Dr. Terrance Young when you are interested in maybe dental work, because he's incredibly gifted with that. But also, he's got other opportunities to help you with your breathing, or maybe understanding why you're waking up tired, or why you're not feeling so, normal. Maybe something has to do with your breathing apnea. Who knows? You might have it. You may not. But you're not going to know unless you get tested. So, definitely reach out to him, please. If not, you guys can reach out to me at befitforhealth.com, bfit4health.com. And from there, I can also direct you on my contact page. You can send me a message, and I can try to direct you to the right, place so that you get the information you need. Okay. This is another day for us. So thank you so much. I want you to go out there and enjoy the rest of your day, and, take care of yourselves and take care of each other. I wish you guys all the best. Aloha.